Stop before you block is a safety recommendation that should be used by all staff involved in the placement of peripheral nerve blocks which involve laterality. When performed correctly, stop before you block is a strong preventative measure to avert wrong side blocks, which are an NHS Improvement Never event. However, stop before you block is often inconsistently applied, so the Safe Anaesthesia Liaison Group have reviewed and updated the guidance. Stop before you block is now a 3-step process. Step 1 is prep. Step 2 is stop. And step 3 is block. Step 1. Prep. On arrival of the patient into the anaesthetic room, block room or operating theatre, the WHO sign-in is performed, which should include confirmation of your patient's identity, confirmation of the operative consent form, and confirmation that the correct operative site has been marked. The blocker draws up the local anaesthetic and places the labelled syringe along with a suitable nerve block needle on a dedicated tray or container separate to the intravenous drugs. This tray is then handed to the assistant, out of the blocker's immediate reach. The blocker and the assistant should now position the patient and the equipment in the final position ready for the block. Where necessary for conduct of the block, any dressings or plaster casts should be removed. A pre-scan ultrasound might be undertaken at this stage. The blocker should now clean and prepare the site ready for the block. Step 2. Stop. The stop moment is a 2-person step that happens only after preparation is complete, and thus immediately before needle insertion. When the blocker is ready, the blocker formally announces to the assistant, "I have completed my prep, let's stop before you block." The assistant should reply, "OK, let's stop before you block." The blocker and the assistant together should then check the block side by viewing the surgical site mark and verbally confirming the correct side. The assistant reconciles this with the consent form. If the patient is awake and unsedated, they may also confirm the side is correct. Step 3. Block. Only when the correct side is confirmed does the assistant hand back the tray to the blocker. The blocker immediately performs the block. Any delay between handing back the tray and performing the block should require the blocker and the assistant to restart the stop before you block process at step 1. This video has been produced with reference to the common context of a single peripheral nerve block. There are numerous other contexts where nerve block or local infiltration injections are undertaken, and guidance for these other scenarios can be found within the standard operating procedure document. Regardless, this video outlines a single framework with the key consistent component being to separate the action of block into 3 distinct steps. Prep. Stop. And block.